Hey everybody, it's April on the Cannabis Care Team YouTube channel. I wanted to make a quick video on cannabis and cancer because it has been something that has been keeps coming up, and I just wanted to address it in a video. I have patients who reach out who are inquiring if cannabis will treat their cancer. I have patients wanting to know how cannabis can improve the side effects of chemotherapy. And it's there's not a ton of information out there, so I just wanted to make a quick video. I'm going to try to keep it under 2 minutes, but number one, what I always do with patients is I always find out, after they tell me they have a diagnosis of cancer, I want to find out what their treatment goals are. So is this someone who's really looking to treat like cancer pain, nausea and vomiting associated with chemotherapy, some of the other side effects associated with chemotherapy? That's going to be a very different dose than if someone is looking to treat their cancer with cannabis. Now, there is no research out there that shows that cannabis will treat this type of cancer in humans. There's a ton of anecdotal stories, which means like personal stories. I've heard those from patients myself. There is a lot of research in animals where we can show like certain cannabinoids affect certain types of cancer. CBG, CBD, those are showing some real promise with cancer. But we just don't have the information right now to say, take this particular strain for this particular type of cancer. It's just not there. So the most important thing for people to understand is that number one, you really need to figure out what your goals are if you have been diagnosed with cancer and you want to consume cannabis. And then, really number two or number one, equally important, find a physician to work with who understands the benefits of cannabis and can help guide you. I'm a registered nurse. I know a lot about cannabis and I know that, but I don't provide medical advice and any specific instruction on how much cannabis to consume, how many milligrams per day, what type of, complementary treatment would be best for a patient is really best advice given by a physician who understands the patient's goals as well. So if you don't have questions about cancer dosing and you want to see something online, definitely check out the Realm of Caring website. They have some cancer dosing guidelines on their website. Of course, reach out if you have questions to us. Go to our website, schedule a 15-minute call. So it's cannabiscareteam.com. We do a free 15-minute call for everybody where we really just provide education. I'm more than happy to get patients referred to physicians who have patients who are doing this. In some states, there's several physicians I can refer patients to. In states like my home state of Missouri, there's not as many, but I will do my best to help a patient get with the doctor that they need to. And I will do my best to help a patient understand cannabis and cancer without providing any medical advice. So there's that. Thank you for watching. Cancer is something that so many people have been affected by. It's such a scary thing to go through. It's not just the cancer diagnosis, it's, all the other things that come along with it, the depression, the anxiety, the hopelessness, the fear. I mean, it's such an overwhelming condition. So, not only are you trying to treat the cancer, but you're really ultimately really trying to treat that whole patient. And I will do my best to do that as well. So thank you again, everybody. Go out and just do something that feels good today. That's what's really important, is you got to do something that makes you smile and makes you laugh every day. So I want everybody to go do that right now. Bye-bye.